So we're going to be talking about 4 points. Know your specialty, how you should think about the USMLE, build your skills, and then mentorship. And the first thing is know your specialty. I just updated this today. This is from 2023 data. And every specialty is different. And I always share this not to say there's some specialties that are impossible. But if you want to match in neurosurgery, then you should know that your career track is going to be really defined by that aim. And you're going to have to spend a lot of research, and a lot of your time is going to be to build connections to get into the right program. There are people that are IMGs that have gotten into every single specialty, radiation oncology, dermatology, but the road is just a little bit more difficult for some specialties. So if you know your specialty, you do have to go, and I would try to figure out who are the IMGs that have matched there and ask their story. Nothing is impossible, but know the challenges. That road for non-IMG friendly specialties will need quite more effort, and you need to prepare for it. This is another easy one, but how you think about the USMLE. I think that as I've gone through this more and more, I realized how much we as IMGs, when we're starting to think about going into residency, we just focus so much on the USMLE, and that's our only thing. And then when it comes for everything else, we kind of just leave it as a side. And knowing that that is just your gateway. I think that now that the USMLE is at pass, no pass, step 1 has changed a little bit about how we think about it, but it is just a way to, I just review, this is interview season for me for HEMONC. I'm the associate program director for HEMONC in our program. I just reviewed 700 applications, and we interview 80 people, and we match 6. And the USMLE helps me have a little bit trend. If you didn't pass your step 1, unless you tell me an absolutely beautiful personal statement of why you didn't pass your step 1, that's going to be a really hard cut for me to interview you for a specialty here. But other programs might have different things. So if you're applying for different specialties, their cutoffs are a little bit more stringent. We just want good scores. You don't have to be the perfect scores that we have sometimes, but as long as you're within the range. So this was when we had numbers, and I use this to just think about it. If you use US grads and IMGs, and this is 250 and above for the steps, even people with 250 and above for US grads, this is people who match in green and people who do not match in red. But even for people with 250 and above, some people do not match, and they're completely what the hell happened? So it's not everything. But if you have a really low score or you didn't pass, then you will really have to define everything else so that you can overcome this. And this is when your personal relationships are important. This is when you literally have to build your interpersonal skills so that you can get programs to review your application and pass that thing over. For other specialties, this is general surgery, of course. Even people who are 250 and above match, but the percentage is just so much lower. And there's a lot of people with 250 and above for general surgery that do not match in that time. So I'm glad the USMLE is not with point system now in terms of step 1. I don't know how much the step 1 really defines everything, but we will watch your step 2, and we will watch your number of attempts. So think about it. Most programs do have a cutoff or do have a number of passes per reviewing. If you have, unfortunately, did not pass the first time, then you really have to think about other ways that your programs look at your application. And don't forget that a good USMLE is nothing. It's just they review your application. You need to build everything else. And then you're going to build your skills. And I do want to spend time in this, and this is where I usually get most of the questions here, skills and mentorship. The skills is, one part of your clinical skills is just get clinical experience in the US, and there's different ways to do it. I think that looking at other IMGs that have matched and have done something, it's important to figure out where they had good rotations, where not. I sometimes get people randomly emailing me to get an observer somewhere. And there are opportunities there. You have to be careful with how you word your emails and how you get your observerships. There are observerships that are completely legit. So if you go to the Harrington program in the University of Miami, there's a whole application and there's a whole set of things that you do, and they're great for letters of recommendation, but you have to know that you have to apply almost a year in advance of your rotation, because if you try to apply 6 months in advance, they're already filled. Mayo Clinic has great observers and there are many programs that have. But when you do this, it's not about the letters of recommendation only. I cannot tell you how many times I have observers all the time. Cornell has an observership program. And sometimes even day one, people are already telling me, yes, I need my letter of recommendation from this. And it's okay, sure, but let me just see how you do over the next 2 weeks, and then we can talk more about it. So in order to get your good letter of recommendation, think about it. I think I wrote 5 letters of recommendation for residency this past cycle, and I think I wrote 7 letters of recommendation for fellowship applications. So I'm writing quite a lot. And that's people who train in these types of programs. We get a lot of observers and we need to figure out how to grade them. So when you do, this is an opportunity to meet potential mentors. So really be mindful of how you can be your best self and best, even though you're an observer, you can act as the best intern on the team. You need to get to know the system. Don't forget that when I'm writing a letter of recommendation, I always ask whoever's working with me, the senior person, to give me feedback. So be nice to everyone and make sure that you're a part of the team. You need to be a team player. And you need to improve your clinical skills. When you do a rotation, don't be afraid that this is an opportunity for you to keep learning and keep expanding your knowledge and hopefully be more passionate about the area that you want to go to. And you also get to evaluate potential programs. So